My name is Dr. Sam Speron. I'm a board-certified plastic and reconstructive surgeon. I've been practicing by myself for about 15 years. I went to Chicago Medical School up north. Residency for my general surgery and plastic surgery fellowship I did at Loyola Medical Center in Maywood. Plastic surgery is a very wide field, and it's mostly known for the cosmetic surgery work that we do, but there's also a huge reconstructive side. I probably do 50-50, so about 50% of my practice is devoted to cosmetic surgery. Of that, I can probably divide it in thirds. So facial surgery is 1/3. A lot of the short scar facelifts, eyelids, mid-facelift type work. The other third is breast surgery, so short scar breast augmentation, reductions, lifts. And then the other third is body contouring, like tummy tucks, butt lifts, liposuction, arm lifts, thigh lifts, those kinds of things. On the reconstructive side, at this point in my career, most of it, I'd say 80% involves skin work of some sort. And what I mean by that is skin cancers, moles, skin tags, lipoma, cysts, that kind of stuff. But I still do quite a fair bit of breast cancer reconstruction, and all sorts of surgeons might ask me for help, from heart surgeons to orthopedic surgeons to general surgeons if they need help in a certain body area. If I had to pick a general demographic, I'd say most people are 18 to 55. But again, I see people as old as 80 or 90 and as young as newborns. I think one of the things that made me very busy from when I first started was a lot of the short scar procedures that I do. A short scar procedure basically means that you limit how much scarring a patient has. Most people will do a reduction and do a scar around the areola, a vertical one, and a big horizontal one. A lot of the reductions and lifts that I do, some can just involve liposuction, where you literally have one little scar, and some can involve what's called a short scar breast reduction or lift, where you only have a scar around the areola and the vertical component. So you're missing the whole big horizontal scar, so it's literally 40% of the scarring that the traditional approaches offer. At my office, we try to offer everything, so I would call that my expertise. So we're open 7 days a week. When people come to the office, I don't try to talk them into a facelift. I try to find out what bugs them. So if they tell me that a certain wrinkle bothers them, I start from this end of the spectrum, talk about lifestyle changes, talk about working out, nutrition, talk about non-surgical options for that wrinkle, and then I move into the surgical things. So I really try to give them a lot of different options and not talk them into a specific treatment option just because I like doing that. There are a lot of different things we do at the office. So we have the Park Ridge Medical Spa. So we do everything from facials, chemical peels, microdermabrasions. We have several lasers. We're lasering all the time, every day. Everything from laser hair removal to vein removal to moles to birthmarks to acne. We also have the Chicago Center for Anti-Aging. So there are some natural supplements that we have, and we offer different services like nutrition services, things like that. So we kind of try to have a comprehensive, well-rounded approach to medicine. I just try to provide expert-friendly healthcare with advanced technology, and I try to make it convenient for the patient. I try to help them with their problem, and I try to help them understand the options, and it's a partnership. It's not something, I'm not trying to force them into a solution. I'm trying to work with them so we can work on their problem together. I look at it as I'm trying to offer them help, and if they think it's a fit, I'd be happy to help them, but I always recommend they get 3 opinions and go who they're comfortable with. In fact, on our website, I've come up with the 7 critical questions to ask any cosmetic surgeon before you let them touch you. So a lot of that is, again, trying to work together as a partnership, as opposed to, I don't ever want to feel like a used car salesman. I don't want to feel like I'm trying to talk them into something. If it's a fit, I think that's what works best, both ways.